How do you prevent knee replacement surgery? How do you protect your knees? If you're interested in this video is for you. Hi, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India, and welcome to this video. In this, we're going to be talking about, you've just gone to your doc, he's told you, time for a knee replacement surgery. You've got arthritis, you've heard all this stuff. How do you prevent this? So number one, is knee replacement absolutely necessary in everybody? No. It depends. If you're not able to walk properly, your mobility is compromised, you're having pain, most importantly, there's swelling. The X-ray shows very advanced arthritis. Yes, you require a knee replacement surgery. However, if you don't have these in a very great extent, then we could manage this without that. And how do you do? Remember, when you're given one part, God's given you other parts to support it. We call them compensatory mechanisms. And the most important compensatory mechanisms are the muscles. I call them the engine of the knee. If the engine is really strong, the force on the tire is relatively less, or other structures is less, that makes the car go forward. So, with a strong engine, it can compensate for a lot of fallacies in the body. Strengthening your thigh muscles, especially the muscles in front called the quadriceps, of which the VMO, or vastus medialis obliquus, the muscle on the inner side of your knee, protects the knee or takes the load off the knee maximum. So strengthening it helps. Apart from that, hip muscles, hip abductors, that's those muscles that take your leg away from the body, and external rotators, that's the ones that rotate your hip outward. Strengthening them takes the load off the knee to a great extent. Number two, if the load is too much on your knee, obviously the knee is going to degenerate faster. So in degeneration, the cartilage goes away. Now, this is not a disease, this is a process of getting old. It is going to progress, but we can delay the progress. So in simple words, this is a table. I love this table because my grandfather gifted it to me. It's an old table, it's getting creaky. I'm worried, the more weight I put, it gets creaky at times. How do I make sure I keep this table for as long as possible? By putting less load on it. Same thing, lower the load on your knees, less the pain, less the progression. So reducing your weight really helps. Your diet. So diet, to reduce weight, so don't indiscriminately eat or overeat. Apart from that, there's certain foods that have antioxidants in them. Remember, any process in your body, be it degeneration, be it breathing, requires oxygen. We use this to our advantage. Here, even the process of degeneration requires oxygen. Can't we have food that reduces the amount of oxygen or for this process to reduce the rate of degeneration? That's where antioxidant foods come into the picture. Stuff like blueberries, omega-3 fatty acids, cod liver oil, these have anti-inflammatory properties, antioxidant properties, reducing the rate of degeneration. Even nuts like almonds, etc., walnuts. So these are good foods to eat. Sorry to disturb you, but if you're enjoying this content and you want more, and you want to know more, and you have people that are suffering from this problem, or you're suffering from this problem, please WhatsApp the number below or call the number below. My team will be able to fix an appointment with me either in person or through a video call to help you. Thank you very much. Apart from that, if you've already got a level of arthritis, not bad enough for an operation, there's a reasonable amount of swelling, etc. in your knee, you can benefit from certain drugs like anti-inflammatories, icing, and certain injections. What are those injections? The biggest and most successful among them is the steroid injection. It has a lot of evidence to reduce inflammation in the knee. So a lot of times the pain is not because of the arthritis alone, but because of the inflammation caused by the arthritis. So if we can reduce the inflammation, excessive lubrication in the knee, that can reduce the pain. So steroids help in that. PRP, platelet-rich plasma, also has similar properties. Hyaluronic acid, which is basically injections with lubricants in them, can also help. And nowadays you even have stem cells for very early arthritis. What is stem cells? Remember, cells in your body enter your body like they're nursery kids. You don't know whether they're going to become a doctor, engineer, lawyer once they enter school, or a businessman. It depends on how they grow, the peer group, the family, and other influences. Same way, the philosophy here is if you can take a nursery kid and put it into a school full of doctors, the likelihood of it becoming a doctor is more. Same thing, you take one of these pluripotent cells, put it into the knee. When it sees cartilage cells all around, it thinks being cartilage is best, it becomes cartilage cells and helps. This is the philosophy on which it works. And this is being used these days for very early arthritis. I hope through this video, you've managed to understand when is surgery absolutely required and what else can you do to delay surgery or prevent surgery. If you like my video, please like and subscribe to my channel, and please follow me on Instagram, Knee Surgeon in Delhi. For those who like Hindi content, we have a very popular silver play button Hindi channel. Please like, subscribe and follow it. Thank you.